Thanks very much. So our agenda for today, after our welcome and introductions, we're going to spend most of our time talking about cost eligibility. This is the, as I mentioned, fourth in a series of 4 trainings on CoC compliance, where we covered participant eligibility, everything to do with housing compliance, and then we're ending up with what can you spend your money on? And we'll also get in a little bit at the end into timekeeping. How do you document staff time through timekeeping? All right, thanks folks for doing those introductions in the chat. There's a lot of fantastic skills. I love it. Okay. So we're gonna dive into eligible continuum of care program costs. We're going to start from the ground and we're going to build up. So this acronym, RADAR, walks through and lays out the 5 characteristics that are necessary pretty much for any federal funding expenditure. These are, this is sort of pulled from the federal cost principles, the federal uniform guidance. And it applies to CoC funding. So all CoC costs that you bill HUD for have to be reasonable, meaning that they are directly related to the grant and they're necessary for completing the grant, right? So if I'm providing rapid rehousing, then probably the cost of taking all of the clients to Disneyland is not reasonable for that grant because it's not necessary to providing rapid rehousing. It's not directly related. It has to be allowable, meaning that it has to be one of the costs that the CoC program interim rule lays out for this program. So it has to be eligible or allowable. And another component of allowable is it has to benefit a participant that's enrolled in this program. So you can't spend your CoC grant funding on a client that's not enrolled in your CoC grant program. And you can't spend it on ineligible costs. All costs needs to be documented, meaning you have to have some form of written documentation of that cost. That can be a voided check, a paid bill, certified payrolls, time and activity reports. You have to have an invoice, something that documents that you actually did make that expenditure. The cost has to be allocable. Then that means that it is incurred directly for the purpose of this specific grant or contract or program. It can't be a general cost for the most part that just supports your organization. It has to be, in order to bill to a grant, it has to be directly and demonstrably supporting that grant. And it has to be reimbursable. You know, it has to be part of your budget. It has to be, it has to be an expenditure that happened during the grant period. So all of these things have to be true in order to bill HUD for any cost. And I want to make a distinction here between a cost that is eligible and a cost that is approved. So we're going to be going over all eligible costs, all of the costs that could potentially be in some CoC grant somewhere. Just because a cost is eligible and it's in the interim rule doesn't mean that you can pay for that with your grant funding, because each grant has its own set of budget line items and approved costs. So if it's in the interim rule, if it's an eligible cost, but it's not in your budget, then you cannot spend your grant funding on that cost. There are 5 general categories of eligible costs, and we're going to walk through each of these. These 5 categories of eligible costs are often referred to as budget line items. And that's because the main components of your budget are these 5. So you can have rental assistance funding, or you can have leasing funding, They're just types of dollars. We're going to be going over all 5 of these. And the way we're going to do this is I'm going to give you information. I'm going to talk at you for a little bit. And we're going to go through some slides that cover these eligible costs. But I'm going to not, I'm not going to read everything that's on each slide. I'm not going to try to make sure that this first time we go over it, you remember everything. That's not the goal. The goal is for us to just walk through the structure and the framework of this funding and show you sort of what you can find in these slides, what information is here. And then Nicole is going to walk you through an exercise where we're going to model how you can use these slides as a tool, how you can look up information on these slides to make your own determinations later about whether costs are eligible or not. So don't worry if you're don't have total recall of everything I go over. To start with, here we go. We're going to talk about rental assistance and leasing costs. Both rental assistance and leasing costs pay for the cost of housing. They can pay for the part of a rent for the unit in which a client resides, anywhere from a percentage of rent to all of the rent if the client doesn't have any income. So both rental assistance and leasing funds pay for the cost of a unit rent, but they work a little bit differently. Rental assistance funding can pay for the client rent up to the appropriate. It can pay for client rent minus the client portion of that rent, whatever that is. And if you're interested in what the client portion of rent is, you can go back to the 3rd compliance training in this series, which is all about housing. But rental assistance funds can pay for a portion of the client rent. They can also pay for security deposit, first and last month's rent. Rental assistance funds can pay for up to 30 days of vacancy, and they can pay up to 1 month of rent's worth of damage to property. So this is property damage that exceeds the client's security deposit, right? So you're not double paying for stuff that the security deposit could cover, but if there's excessive damage to the property and the security deposit can't cover it, you can use rental assistance funds. For leasing funds, if this is the type of housing funding you have, then you can, of course, cover unit rent, and you can also pay for security deposit, first and last month's rent, HQS inspections, and you can make vacancy payments. Vacancy payment rules work differently for rental assistance and leasing. And if you're interested in that and all of the details of rental assistance versus leasing, I'm going to direct you to, again, day 3, session 3 of this training, which is on all of the housing components. So sometimes our rental assistance funding doesn't get completely spent down. This is actually pretty common. So there's often a client contribution to rent for rental assistance projects. And so you're not necessarily needing to spend the full amount that HUD gives you for each unit because the client is covering part of it. So it's possible and frequent for programs to have extra rental assistance funding. We often get the question, what do we do with it? So you can cover all of those other costs. You can cover security deposits and property damage. You can cover eligible staff costs with your rental assistance funding, meaning the costs of things like cutting checks, doing all of the staff things that are necessary and tied to administering the rental assistance. You can cover the costs of rent that exceed fair market rent. So maybe some of your clients can't find a unit under FMR, under fair market rent, but they're finding expensive units that are just, it's reasonable that they're expensive. All of that type of unit is expensive. You can pay a little above FMR. You can also, if you have a lot of underspending of your rental assistance budget, can serve more participants. So there's options for spending down your rental assistance budget, and we're always happy to talk that through if you have questions. The next budget line item we're going to talk about is supportive services costs. So every CoC funded permanent housing program, the PSH or rapid rehousing, and also transitional housing, must provide services. This is a required component of the housing program. The services that you pay for have to be eligible, of course, but they also have to be necessary to assist the program participants in their goal of obtaining housing and retaining housing. For all of these budget line items, but particularly relevant for supportive services, a lot of times your supportive services costs are going to be staff costs. They're going to be salary costs, and also supplies and materials that your staff are using to conduct those activities. So for example, if your staff are, part of their case management is transporting clients to receive eligible services, you can pay gas for that agency vehicle that is being used for that eligible purpose, right? It's a material, it's a supply that is necessary for that eligible supportive service. So what are the supportive services that are eligible? Again, we're not going to go over all of this detail in a lot of detail. I'm just going to give you an overview of the landscape so you know where we are. So this slide shows all of the eligible supportive services costs, right? There's a lot of them, and just looking at this slide doesn't really give you the information that you need to figure out specifically what is eligible. So childcare is on this list, but there are limits to which households can get childcare. It's about the age of the child, and also what childcare can be paid for. So just looking at this slide gives you a sense of the types of things that you can cover with CoC funding, but it doesn't give you all the detail that you need to really make a determination of whether a specific cost is eligible. And we're going to go through, we have a slide for each of these. So we're not just going to, we're going to give you that detail, but just know that this is a good place to start. And then you want to go to the specific slide. So for example, outreach services, there are specific components of outreach services that can be paid for with your grant. If you're doing things like, you get a referral from coordinated entry and you need to find that client and determine that they're eligible, that is, doing that initial assessment can be something that you pay for with your outreach. Case management, the thing that we all do in all of our programs. This is pretty broad as a category. As you can see, things like monitoring and evaluating progress, counseling, helping folks connect to benefits, coordinating services, using coordinated assessment. Pretty much all of the things that you do as case management are probably going to fit somewhere here. Transportation. So this is where it gets pretty specific, right? You can't just provide blanket transportation resources. There's certain types of transportation and ways of paying for transportation that are allowed. Some client travel can be paid for, but it specifically client travel to and from services, so medical care, employment, childcare, or other eligible CoC services, right? If you can pay for it with CoC funds, you can provide transportation to that thing. Even if you're not the one paying for it in this case, if you're helping the client get that eligible service, you can pay for the transportation. And you can do that through public transportation. You can do that through purchasing or leasing an agency vehicle. and that can include gas, insurance, etc. Yeah, that can include the cost of staff going with clients or helping them use public transportation for these purposes. And then there's mileage allowance for your staff to visit clients and do their HQS inspections, etc. Moving on to housing search and counseling services. This is like your, how do we help clients find housing? How do we help clients understand leases? Understand getting clients through the process of getting their utilities. This is not paying utility costs. This is helping clients get signed up for utilities. All of those housing related things that are on this slide will fall under housing search and counseling services. All right, so I want to check in with you all because I've been talking for a while. So we're going to be doing a little check-in question, and we're going to call back to that first concept that we talked about: reasonable, allowable, documented, allocable, and reimbursable. Right, so trying to activate that thing, the concept that we went over right at the beginning. So our example and question is: a case manager in a CoC funded program has a client that's moving out of the client. So the client is moving out of their apartment. Can you use CoC funds to pay for the move if you don't have a supportive services line item, right? So you're sort of thinking you don't have supportive services funding in your grant. You don't know what you do have. And you're thinking through, is this a reasonable cost? Is it an allowable cost? Can you document it? Can you allocate it to the grant? And is it reimbursable? All right, I'm seeing some answers. And this one, like as all of our polls throughout the training, if you don't know and you can't remember the information, take a guess anyway, use your best judgment. And wrong answers and right answers are both really helpful and an opportunity for us to learn and activate this information in our brains. All right, thanks everyone. We have great participation. Now I'm going to end the polling and throw the results up. So yeah, we're not quite sure. And that's totally fair because you've just had maybe 20 minutes of me talking at you. So perfect recall is not an expectation. But the answer here, the short answer is no. And we're going to walk through each of these. This cost is reasonable, right? It's related to the client's needs, the client's housing related instability needs. It is also allowable. This is one of the things that supportive services costs can be used to pay for, moving assistance. It can be documented, I'm sure you can get invoices, receipts. It's allocable, right? And allocable means you can track it directly to this program. It's very clearly supporting this particular client who's enrolled in the program. The catch is it's not reimbursable. Because this is a supportive services cost, it's an eligible cost, but you don't have supportive services, it's not in your budget, you can't pay for it. All right. Thanks for being brave and participating in that poll. We're going to continue on with our journey through all of the many supportive services. So education is a potential supportive service. All of these supportive services, you can either provide in-house, you can provide education through your own staff, or you can pay for the costs of these types of education outside.
That's fine.
So we're gonna, yeah, thanks folks, thanks Nicole. So the way that education services are broken down in the interim rule, they list out the types of services and the types of areas of education that can be covered, and they list out the types of activities. So you can do, in health education, or let's say literacy, you can screen for the need for literacy education. You can do assessment and testing of someone's literacy. You can pay for literacy tutoring or individual or group instruction. You can pay for books and supplies, counseling, referral to community resources, all for to focus on building up the client's literacy. You can do all of those activities for ESL or GED or any of these other areas of education. So it's both fairly broad, but also fairly it's deep, like it's specified. This is not a general, broad, any type of education thing. It's specific areas and specific component activities. Job training and employment assistance is a hugely important area of supportive services, particularly for our rapid rehousing and transitional housing programs. Supportive services funding can be used to pay for vocational license and certificates, anything, any job training or employment assistance that will increase earning potential. So even if someone is employed, if there's a program or a path that can lead to living wage employment or higher wage employment, that's eligible. And things like, counseling and job coaching, job skills and job seeking skills, all of this stuff you can pay for externally. You can refer folks to, or you can provide in-house using this funding. And life skills training. I know this is something that is really a focus of a lot of programs as well, both rapid rehousing and transitional housing, and also PSH. All of these life skills things that really support stability, right? Helping folks learn and figure out how to manage and meet their own needs independently, because in some programs, the assistance is going to end. And in other programs, we just want folks to grow in independence and autonomy. And so any of these life skills services or education can be paid for with this funding. And again, that is, paying for external support and training. So maybe there's a budgeting and money management course that you want to pay for your clients, or you can do that internally and you can provide that with your own staff. Childcare, right? I mentioned there were restrictions on the type of childcare you can pay for and for whom. So there are age restrictions. So you can pay for childcare for children under 13, or a child who has a disabling condition who is under 18. And whatever childcare you use just needs to be a licensed childcare facility or licensed childcare provider. Okay, another quick activation of this information we're going to go over. So in this example, a case manager in a CoC funded program, a CoC funded rapid rehousing program, has a client that needs some courses to get their GED. Can you use CoC funds to pay for online GED courses if your budget includes line items for group instruction and you print out the enrollment receipts for the client file? So you can see this example is giving you a lot of information, and we're comparing that to our radar characteristics. So I'm going to throw up a poll for this one and see what we think. Is this something that you can pay for under these circumstances? And we're thinking, so is GED education and support in the interim rule as an allowable cost? Does it seem reasonable? Can we document it? Can it be allocated to this grant? Can it be reimbursed by HUD? Excellent. I'm going to see maybe 3 more seconds, 2, 1, those last answers in there. Awesome. Yeah, so again, a little disagreement here, but for the most part, most folks think yes, this is, so let's walk through it. I mean, yes, clearly reasonable, right? Getting employment and also education in itself are important to housing stability. This cost is allowable. And if you had these slides in front of you, you could go back to the education slide and take a look somewhere here. Yeah, education, right? GED education is on there. And, individual or group instruction. So a course would be allowable. So we know that it's reasonable, it's allowable. You can document it because you're going to print out the enrollment receipts. It's allocable because it's clearly benefiting this client who is enrolled in the program. So it's directly connected and tieable to that grant. And key, it can be reimbursed. The client is currently enrolled in the grant, it's during the grant term, and it's part of your budget. So HUD can reimburse you for this. So yes, this is good. Good cost. Just a few more supportive services. There are a lot of them. Legal services, but again, not broad scope of legal representation. There are specific types of legal services and legal supports that you can pay for. Some key and specifically called out ineligible legal services are legal services for immigration and citizenship matters. And this is, we know, very unfortunate because those are challenges that face a lot of our clients and barriers to housing stability for a lot of our clients. But unfortunately, programs need to find other resources outside of CoC funding to support clients with immigration and citizenship legal support. Okay. And then supportive services also includes outpatient health services as outlined on this slide. So you can pay for medical care and medication. You can pay for mental health services. So you can pay for or provide in-house all of these services. You can provide counseling, therapy, prescription medication, mental health services. And this includes, mental health services includes all behavioral health care. So this can include mental health care for substance use as well. And then there's this great miscellaneous, right? So substance abuse treatment services is actually included under HUD's miscellaneous category, but it covers, intake and assessment, outpatient treatment, group and individual counseling and drug testing. This funding is not going to pay for residential treatment because the idea is that the client is going to be housed in your program. Supportive services can also cover utility deposits, not ongoing utility payments, but helping folks get, making a deposit for utilities. And then meals or groceries, food for program participants. So we have covered 3 of our 5 eligible cost categories. We've covered rental assistance and leasing, which pay for housing, and we've covered all of the supportive services that are eligible. I want to pause here to see if there are any specific questions about any of that. Go ahead and put it in the chat if you have a question. If you don't have a question, you can pop into the chat and say, oh, great. If they don't have income, can we pay utilities? Can utilities be paid? That's a great question. And that actually goes back to day 3 of the compliance training, where we covered the client portion of rent and we covered utility allowances. So it's a great question. And it's actually related to your rental assistance or leasing budget line items. And what you would do is, if the client doesn't have income, their portion of rent is $0, because any percent of 0 is 0, of course. So then you would go through, okay, what eligible utilities are not included in their rent? Are there any utilities that they are paying for out of pocket outside of their rent payments? And if there are, then yes, you would look up the utility allowance on the Housing Authority utility allowance schedule for those utilities, and the client would get a direct payment from you to cover those utilities. You could also pay for those utilities by paying the utility company directly, but in order to do that, you need to get, consent from the client to do that, and notify them that you're going to do that as well. So you can either pay the client directly, or you can talk to the client about paying the utility company. Transportation to medical and mental health appointments. Yes, and to answer that question, we go back to the transportation slide and see that, well, where is it? You can see that client travel to and from medical care and other eligible services. So medical care is called out, and mental health care is an eligible service. So transportation to those would be eligible. Does Homebase also provide training on ESG, CDBG, home, and other HUD funding sources? We do have a ESG compliance training on the CoC website that was recorded and was pretty recent. We don't have trainings currently on CDBG, home, or any other funding sources. Yeah, thanks, Nicole. We have an ESG 101 training series. Cell phone payments, it's a good question. It's a good question. We can look through the slides. I don't know the answer to that off the top of my head. Again, I don't have total recall of this stuff. But yeah, we can look through that. Maybe one of my colleagues will have an answer to that as I continue presenting. All right, great. Thanks so much for the questions. You gave us a nice little break from me presenting from slides. I appreciate it. We have two other budget line items, two other categories of costs to cover. The first is operating costs. So costs associated with the day-to-day physical operation of a housing facility, a building where housing is provided. So that's distinct from maybe you're using your CoC funds to pay for a building where you're providing supportive services. That's something that you can do. You can lease a building to provide supportive services, but you can't then pay for operating costs for that building. An important thing about operating costs is that you can combine them with leasing, but you cannot combine them with rental assistance funding. So if you are using rental assistance budget line item to pay for your housing portion, you can't also have an operating costs line item. Operating costs are specifically designed to support a building that the provider leases or owns. And it's to pay for things that would be covered, should be covered under rent, and should be the responsibility of the landlord if you're paying for rental assistance. Things like maintenance and repair of the housing, property taxes and insurance, building security, electricity, gas, water, furniture, equipment, all of these things that if they're your responsibility under the lease, or if you own the building, you need to be able to pay for. One of the other things that I like to call out about operating costs is that allocable piece, right? These costs need to be allocable to the grant, which means you need to be able to identify which portion of these costs, maybe building security, is directly supporting your CoC enrolled clients. So say you own a building and half of the units are CoC funded and half of the units are supported with other sources of funding, maybe MHSA or something else. And you provide certain types of building security and you pay for the electricity and gas for that full building. If you have operating costs in your budget, you need to make very sure that you are only allocating to your CoC operating funds the amount of funding that is supporting the CoC half of that building. You can't cover all of your building security. You can't pay for all of the water costs. for that building, because only half of those costs or some portion of them are allocable to your grant. And there are a variety of ways of how to do that allocation. I would say typically in that kind of situation, just the percentage of units and then prorate those costs is probably a reasonable way of doing it. So before we get into administrative costs, I want to call something out that I've said a few times, but it's something that does come up when we get questions about or we see errors with in files. And that's, where do you bill the staff costs for providing services or for, administering rental assistance? Those staff costs should be billed to the eligible activities. So if you have supportive services staff costs, bill it to supportive services. If you have staff who are doing those operating eligible costs, like providing building security or doing maintenance, you pay those staff costs out of the operating budget. You don't bill those to project administration, right? They may be about administering the grant or the project, but they are not eligible administration costs. They are billable to and chargeable to the specific eligible costs. Which brings us to administrative costs. So admin costs with a CoC program grant are special, they're particular. Often we talk about administrative costs and overhead costs and indirect costs sort of as the same thing, right? It's just the cost of administering our agency, right? They're admin costs. But in the context of a CoC grant, admin costs means a specific set, a delineated list of eligible expenditures that are tied specifically to administering the grant, not your general admin for your agency, but things like coordinating the grant, training on CoC requirements, staff costs for preparing program budgets and ensuring compliance with the grant, entering into agreements with contractors, very specifically tied to how do we use this grant? How do we make sure we're using it correctly? How do we pay for the structures that we need specifically to run this grant? It's not general agency admin. But it is, there's this general management oversight and coordination category under administrative costs. It sounds very general. It sounds very general admin costy. But as you'll see, if you read through this list, it's a specific set of things that relate to meeting the requirements of this grant. Including, if you're monitoring subrecipients, you can pay for travel costs for the staff that are doing that. You can pay for general legal services and accounting services and audit services. You can't cover the full cost of those for your agency. You can cover a portion of those costs. That's, again, allocable to your CoC grant. But if you're using, accounting services or audit services for your CoC grant, you can cover those. And then other things like rental or purchase equipment, insurance, utilities, office supplies, other things on this list that are, again, allocable specifically to your CoC grants. So allocable, that concept becomes, administrative costs are one of the areas where that becomes really important and key, because administrative costs often are shared. Other types of costs can be shared. So we talked about operating costs, right? You have a building and part of it's CoC funded, part of it's not, but you're paying for services for that building. That's, for you as an agency, that's a single cost, but it's benefiting both a CoC grant and another funding source or another cost objective. So if you have a cost that for you is a single cost, but it benefits more than one grant or more than one project, then you have to find a way to allocate it. And there's a lot of rules that HUD lays out about how that has to happen. It's actually the federal government that generally it's the uniform guidance that applies to all federal grants. And if anybody who is interested in those specific rules, we have pretty good summary of those rules. So if you are responsible for doing this in your agency and you have questions, just know that there are a lot of rules. You have to have a written cost allocation plan and it needs to be compliant. And we do have some additional information on that. So reach out if you have questions. Okay. We're actually going to, I think we've done enough comprehension checking. So I'm going to skip right to questions because I want to prioritize time to answer your specific questions about eligible costs before we get into our activity. Any other eligible cost questions? Great question, Alex. Yeah. We can put our home-based email into the chat. So that's our home-based email for you all in Santa Clara. That email goes to our full team here. So it's the best, it's the way we recommend you get in touch with us. Because it'll go to something like 7 or 8 different people and you'll have the best chance of getting the quickest response. But yeah, feel free to reach out there if you have any other questions as well. Other eligible cost questions? Tricky stuff you've been encountering? Okay, well then I am going to I'm going to pass the baton over to Nicole, who's just put some links in the chat. But we're going to be doing the modeling activity, and as Nicole goes through that, I'm going to look up that question on cell phone payments.
And as we're going through that, we also did receive a question on if diapers and wipes are okay.
Got it. Can look up that.
The 2 links that I dropped in the chat are some of those resources that Eli was mentioning. So there's a decision tree along with a really helpful resource and guide that lays out some key definitions. And we're happy to follow up with those links again in our follow-up email. So you'll have the slide deck, all of our materials. And again, just feel free to reach out to us directly.
Thanks, Nicole. That's the federal cost allocation stuff. Yeah. That's great. Thanks.
And all of those resources are on the CoC website. If you go to CoC Toolkit, CoC Forums, a lot of great resources for a lot of the things we've covered over the past 4 days. With this modeling activity, let's imagine you're now back at work, you're working with your program, and you're not sure if one of your costs is eligible. We're going to be modeling and walking through the slides Eli just covered to model how we could use this slide deck as a resource to help us match budget line items with eligible cost categories. So with our first cost, we're looking at mileage and staff vehicle, in a staff vehicle to serve clients. And we're going to ask ourselves, what eligible cost category might this fall under? And we're going to use the categories of eligible costs as our starting reference point. And for this activity, next slide, please. We'll return to this slide multiple times. So this is a good reference point, a good starting point, because it lays out our cost categories. We see rental assistance, leasing, supportive services, admin costs, and operating costs. And maybe I haven't looked at the slide deck since the training. It's been months and I haven't really been thinking about eligible costs. So I need to refresh my memory a little bit. So I'm going to go through each one of these cost categories to see where my budget line item may fit. We'll start with rental assistance and leasing costs. So with rental assistance and leasing, I see that this is about funds to pay part of or the full rent of a unit. And I'm seeing things like security deposit, first and last month's rent, property damage, HQS inspections for leasing, but I'm not seeing anything pertaining to mileage for staff vehicles to serve clients. So I'm going to move on. With operating costs, I see that these costs have to do with the physical operations of the facility a participant is housed in. So I'm seeing gas, but that's not relevant to my line item of mileage and staff vehicles. So we'll move on to supportive services. With supportive service costs, here I'm seeing it can include costs of labor, including those supplies or materials that are directly related to providing the services. I'm thinking maybe this is getting closer to what I'm looking for. And then I see the example on the slide is gas for an agency vehicle used to transport clients for the purpose of providing eligible services. So this feels like a close fit to my line item. I'm feeling pretty good about this cost category, and I'm just going to look a little bit closer. So I know there's a slide that lists out supportive service costs in further detail. And when I'm looking through this list, I see transportation, which is great. And I know there's a slide that talks about transportation in further detail. So I'll go to that one next. And on this slide, I see very clearly laid out mileage allowance for service workers to visit clients and to carry out housing quality inspections. So mileage allowance is exactly what I'm looking for. It's great. It's a match. But again, it's been a while since I've looked over the slide deck. I just want to check all the cost categories to cover my bases, triple check. Feeling good about this, but let's just look at the other ones in case. So with admin costs, I'm seeing this has to do with general management, oversight, training, nothing to do with mileage yet. I'll keep looking. Here I'm seeing more things on compliance, audits, monitoring, but again, nothing around mileage. Here I'm seeing travel costs. So I might pause for a moment, but these travel costs are for monitoring subrecipients, so I'm still sticking with supportive services as my cost category for this line item. And now I've gone through all of the eligible cost categories, and I'm feeling confident matching this to transportation. Next slide, please. Matching this to transportation. But again, I would only match this if supportive services was a line item that was approved in my project budget. Let's move on to our second example, which is rental application fees. And again, I'm asking myself that same question. What eligible cost category might this fall under? I'm going to go back to that reference point that lays out those categories of eligible costs. And for this line item, I might think rental application fees, rental assistance. They both have rental in the name. That's where I'm going to start looking. When I go to the rental assistance and leasing cost slide, I'm actually not seeing anything about rental application fees specifically. So at this point, I'm not going to definitively rule it out, but I'm going to keep looking. I'm going to move on to operating costs. And here, I'm not seeing how it would slot into operating costs either. These costs are really about the day-to-day physical operating of the facility. So I'm going to keep looking. I'm going to move on to supportive services. Here I see in bold, provide services to assist transition from homelessness to supportive housing, and that it must be necessary to assist program participants to obtain and maintain housing. You know that rental application fees are a necessary component to obtaining housing. So this might be what I'm looking for. But let's go to that slide that lists out supportive service costs in more detail. So I'm looking through this list and I don't know, maybe rental application fees are under moving costs. Maybe I'm looking at housing search and counseling services. To be honest, I'm not really sure what that entails. It feels a little vague and I don't really remember. So let's go to that slide where it talks about that in a little more detail. So I'm on this slide, and as I'm looking through, I see payment of rental application fees. Lucky me, that's a perfect match. So I match my line item to supportive services, housing search, and counseling services. Again, really want to underscore, can only match this if this line item was approved in my project budget. We're now going to go over our last example and then just pause for any questions you may have. So this is our one final cost for the day, and that's an HQS inspection for a leased unit. Same question. What eligible cost category might this fall under? By now, hopefully, we can anticipate what my next step is. We're going back to that same reference point, that same slide that listed out those cost categories. And with HQS inspections, I might think it falls under admin costs. And my thinking with that is that HQS has to do with compliance. I saw a lot of compliance things when I was looking through admin costs. So I'm going to jump to admin costs. And here I'm seeing environmental reviews. And I don't know, maybe that's close enough. Let me just continue looking through admin costs for the moment. On this slide, I'm seeing more points around compliance, but nothing specifically calling out housing quality standard inspections. I'm going to move on to more admin. This is still admin costs. I'm not seeing any specific HQS callouts. Not at a point where I'm going to definitively rule admin costs out, but maybe I'm going to keep looking. So I'm going to move on to a different cost category, look at rental assistance and leasing costs, just to make sure. And as I'm on the slide, it turns out I do see an HQS call out. That's a perfect match for what I'm looking for. So in leasing, I'm seeing housing quality standard inspections. So I'm now matching housing quality inspections for a leased unit under leasing costs and HQS inspection. Here, I just want to pause and note that some costs, like HQS inspections, I might think that they logically fit into multiple categories. For example, I thought it would fit under admin costs. HUD has explicitly housed it under rental assistance and leasing, so we need to be billing it under that. And HQS inspections are directly related to administering rental assistance and leasing because, as we noted in day 3, HQS inspections are required before you can spend funds on the unit. I will also note that other costs, such as lead-based paint inspections, are eligible, but they're not explicitly stated on the slide. And I might forget that I just now mentioned it for 2 seconds during this training. So I only mentioned that as a perfect example that this is a perfect opportunity and a time where you might want to reach out to Homebase. And we would be more than happy to confirm that for you. There's a lot of detail in this. When you have asked questions, we've been modeling that we ourselves don't always completely have it in our memory every single cost, but we can use these resources and refer back to it. And that's what I hope was really illustrated through this modeling activity. So we're going to pause just for any questions so Eli can answer maybe some of the questions that were asked, and then we'll move on to our next section.
Yeah, while you all think through your current questions, I have an answer on the cell phone question. So there's actually a very helpful FAQ response on HUD Exchange. What is HUD Exchange? So HUD has a website called HUD Exchange that has a lot of resources and information about all of their funding programs, including a section specifically about the Continuum of Care program. And there's a page called CoC FAQs. This is often a very, very helpful source of HUD guidance. It is official HUD guidance and it's published, meaning it's applicable to all grantees. So it's really nice when we have an FAQ response that answers one of the questions. So the question is, the FAQ is, may recipients and subrecipients of funds purchase cell phones and wireless service plans for program participants to use when receiving supportive services? And the answer is yes, under certain conditions. So the costs of supplies and materials incurred by the grantee when directly providing supportive services is an eligible supportive service cost. To qualify as an eligible supply and material cost, the cell phone must be owned by the program, and the wireless service plan must be the program. So the grantee, you, the recipient or subrecipient. But the phone may be loaned to program participants as needed to enable provision of supportive services, such as case management, mental health, and outpatient services. The phone and phone service may be loaned to the participant while stay-at-home or social distancing orders are in effect in the community in which the program participant resides, and must be returned to the recipient or subrecipient when those orders are lifted. So this sounds like something that is allowed specifically for COVID times to enable that case management and connection. So generally no, yes, if it's you as the grantee own the phone and you're providing that to clients in order to allow that case management and that service provision when the client can't leave their house. Any other questions?
Actually, I have a quick question. So for some programs, like, would you have the ESG inspection report and the HQS for some programs? Or should the program have to decide to use one or the other?
Great question. So let me make sure I understand the question. Would you use, so for a particular program, could you use both the HQS inspection or the ESG housing habitability standards? Yeah.
Yes, habitability.
Yeah.
Yeah, correct.
So the answer is it's all based on the funding stream. CoC program funded units, you have to do the HQS inspection. ESG funded units, you have to do the ESG habitability inspection.
Okay.
Yeah.
So it is an ESG program. So, okay. So then they wouldn't have to do, so they're just doubling the work. They don't have to do the HQS and they could just do the ESG then.
In some, so the only caveat, only caution I would add is sometimes you have a program that has both CoC and ESG funding, or ESG and some other funding source that requires additional inspection. So I would definitely check what are all of the funding sources for this unit specifically. Great. Okay, thank you. I'm getting better answer to that from Trang. So yes, actually for ESG, the guidance from the county is that we do both. And it sounds like that's because HQS is more comprehensive, which is true. And so you're doing a better inspection. Yeah.
Yeah, the ESG is only like a 2-page document.
Yeah. So that makes total sense. And that's not a local best practice guidance and requirement. I think it sounds like because it's better for clients and we're making sure that the housing is truly up to standard. So thank you, Trang. Appreciate that.
Great. Thank you.
Yep. Thanks for the question. Yeah. The question about diapers, I think, yeah, I'm still waiting on that answer. I wasn't able to look it up, but we've got colleagues at the office or on the internet looking it up.
We will follow up with that because I do think we've received that question in the past. So we'll just look at it.
We have the answer. I just don't have it in my brain. Okay, so I'm going to talk very, very quickly about another type of cost. We're not going to get into indirect costs in any kind of detail. I just want to flag that they exist and point to actually the resources that I believe that Nicole put in the chat earlier, and make a distinction between indirect costs and your admin line item. So Indirect costs are available for continuum of care program grants. And in the federal grant universe, indirect costs mean those overhead, general agency, how you keep the the motor running type things. They are costs that are incurred for a common purpose that benefits multiple projects, multiple cost objectives. And it's a different way of covering shared costs than doing that through your eligible line items as sort of your direct eligible program costs. Indirect costs are the sort of use of that funding can be a little more flexible. But the amount of indirect costs you can get is limited and controlled by the rules of the uniform guidance. So key things to know about indirect costs are that the admin budget line item and indirect costs are separate concepts. Your admin line item is used to pay for the specific delineated eligible costs under the admin cost in the interim rule. And your indirect costs are the way that the federal grant structure identifies and covers some overhead costs, those other shared costs that maybe are too difficult to assign and allocate to a particular project or grant. So there's a formula that you can use for indirect costs. Drawing down indirect costs does not increase your grant amount. This is not additional funding that's available. You would just spend the bulk of your grant on direct costs, and then some of your grant you might draw down as indirect costs. If you want to draw down indirect costs, you have to include that in your funding application if you tell HUD. And before you do, I would, if you're not already using indirect costs and you think your agency is interested, I would strongly recommend that you reach out to home base and definitely look at some of those materials that Nicole posted in the chat. Those will cover cost allocation and also have some information about indirect costs. The reason that we recommend that you reach out to home base is that, or just do a lot of research, is that it's a thing. Like getting indirect costs, you have to be really intentional about it. There's a lot of decisions to make, and there are a lot of rules around it. So that is our little message about indirect costs, and we really encourage you, if you're interested, to follow up with us. With that, again, I'm going to pause for questions, but I'm just going to see if any questions pop up in the chat or from you folks while I introduce our next section. So feel free to bring up any questions. But for our final section of the training, we're going to hear from the delightful Kyle, who is going to talk to us about timekeeping. And I vamped a little bit. I'm not seeing questions in the chat. So Kyle, take it away.
Great, thanks so much, Eli. So to wrap things up today, we're going to move quickly through the concepts of timekeeping. So next slide, please. So at home base, we track our time in 15-minute increments for a number of different projects. And frankly, it's no one's favorite part of the job. But we do try to do that to the best of our ability to make sure that we're doing that in a timely manner and to keep it updated, because we can also understand just how important that can be. So first, it can be important to project the cost of future activities. I know that if I don't track my time accurately, then my team lead and our managing director may not be able to estimate the cost of the next similar project that we're going to take on, because they won't know how much time that's going to take. And second, to the extent that we receive any grants, our organization is not going to be compliant with grant requirements if they cannot see how much time I spend on a particular activity. So, that means that they're not going to be able to submit accurate reimbursement requests. And ultimately, we or our clients, in the worst case scenario, may not be able to pay back grant funds if I am not completing my timesheets in a timely and accurate manner. And I don't want to put that on all of us individually. There's a whole system and structure of compliance that's trying to make all this work. But it is important that we do our part in filling out our timesheets in a responsible manner. And something that I have found to be helpful for me is to build in time to do it and just finding an approach that works best for me, either doing it at the end of the day or at the end of the week, or say between activities throughout the workday. Usually I record my time using the Apple Notes app and then transcribe it onto my computer later. The important thing is just finding something that works for you and that cuts down the burden as much as possible. So next slide, please. So in order to bill HUD for time that staff spends on a particular activity, you have to document that staff time. So the regulation that governs this is Uniform Guidance, so 2 CFR or Code of Federal Regulations 200.430. And what the Uniform Guidance says is that it's actually fairly generic about the requirements for documentation of staff costs. So whatever the documentation is, it has to be able to support the allocation of staff time among specific activities or cost objectives. The bottom line is you have to be able to track time to a specific grant. It has to be really clear that this time is benefiting this grant. You have to have a standard way of tracking time and incorporating that into your official record keeping. The particular time tracked for a particular staff person has to include the total time for which the employee is compensated. So your method of documenting staff time has to include not just the time spent on the CoC grant, it also has to include the time spent on other activities, including internal activities, as well as sick time that is compensated by the organization. And then of course, your staff time, your time tracking has to be part of a system of internal controls to ensure that the staff time tracking is accurate and that changes to a CoC grant are going to be, or that charges rather to a CoC grant are going to be allowable and also properly allocated between that grant and the other things that your agency is doing. And you should have your own accounting policies and procedures that govern timekeeping as well. So next slide, please. So we often talk about time and activity reports. So this is still a relevant concept, even though the uniform guidance no longer references time and activity reports. It's a phrase that is sort of a holdover from the previous guidance. But our best recommendation is to continue thinking of time and activity reports in order to comply with the fairly general statements displayed in the previous slide. We find that that is what HUD is really looking for. So a time and activity report in its totality must account for actual time worked. It cannot be an estimate. It can't be a projection. And it cannot be a percentage of an activity or a percentage of a person's total time spent on the project. It has to be actual time. It needs to be pretty specific to the amount of time that's been worked or time that's spent on the project. You don't have to do it by the minute by minute or in 5-minute increments, but tracking time for say 4-hour increments probably is not going to be specific enough to the actual time spent on a project, unless you really did work 4 hours on the exact same thing. So you have to track time specifically to eligible activities and eligible participants served. So not just I was doing a supportive services thing for a CoC grant, having that in your record is just not going to be enough. Your record has to reflect which client was being served so that HUD can verify that that client was actually a CoC supported client, and it has to reflect what you were doing for that client. It could be I was doing a monthly case management meeting, or I was doing an annual assessment for my program specific data elements for this client in this permanent supportive housing program. What is the thing that you were doing so that HUD can confirm that your time is eligible? So all this has to align with the other backup documentation that you're pulling in to support your record keeping. So for example, you may reference case notes, or may you reference a case manager's calendar as evidence that was how you were spending your time. And you need to track all the staff time too, including staff time that can be billed to the CoC grant, as well as time spent on ineligible costs that cannot be billed to a CoC grant. If you have multiple grants and a single staff member is working on a CoC grant and an ESG grant, for example, and is also doing some internal work that is internally funded, you have to track those specific funding sources so you can see the full amount of time that the staff person is spending for a grant. So next slide, please. So the big takeaways here: track time by grant, by client, and by eligible activity, and track all of the time, including time spent on eligible and non-eligible activities. The next slide.
Kyle, I'm going to jump in to make
yeah, go ahead, Eli.
Point on something. So the time and activity reports, again, as Kyle said, this is what HUD is looking for, but we don't want to suggest that this all necessarily has to be in one place in a timesheet. So for example, you can track the activities that your like the eligible activities and the participants you're serving in HMIS via your service transactions. And as long as that is clearly recorded and can be tied to the the other ways that you're tracking your time, right? As long as you can easily and quickly and routinely pull information from whatever your sources are and pull together this complete picture. It doesn't all have to be recorded in the same place. I hope that makes sense, and let me know if there are any questions about that.
Yeah, thanks, Eli. That's a great point. And if your project is providing many different services to your clients, could be case management or legal services or rental assistance, certainly utilizing the service transactions features in your HMIS is going to be a really good way to do that. Okay, next slide. So some of the red flags that we see from time to time when a staff member is billing 8 hours or whatever the length of time spent in the workday is to a single grant, that can raise some concerns. That can be a red flag because it can be quite unusual for someone's full time in a day to be eligible to a single CoC grant. And it's also pretty unusual for someone to be working on, one thing all day. Even if that is the case, we don't just want to see a block of 8 hours. What we want to see is time spent on specific eligible activities. So you spent this hour on this activity and this half hour on this eligible activity, because just 8 hours billed to a single grant is both not adequate documentation and also kind of unlikely. So that would be a red flag for HUD potentially when they are completing the monitoring. So make sure that your time and activity reporting is reviewed against your invoicing and that your invoicing is actually based on your reporting. It's not going to do you any good if you don't have really accurate time activity reporting and if you're not invoicing based on that reporting. So time and activity reports that don't include any sick time or vacation time, if you're looking at overtime and you're not seeing sick time or vacation time that's being billed, that's going to be a problem also because that means either your staff has not taken vacation time, which is concerning in and of itself, or you're not including that in your reporting and you really do need to be. And one of the big things that we see is that the total time and activity reporting documentation is missing one of these things. Maybe it indicates that the client is being served and which grant is funding the service, but it doesn't identify the eligible activity. It just identifies the supportive services line item, but it doesn't identify the eligible supportive service itself. Or it identifies the eligible activity, but it doesn't identify the client that was being served. So the main takeaway for documentation of eligible cost in general is if you do not document it, HUD will assume it is not eligible. So if you don't document that the client was being served and you cannot prove to HUD that this was the client that was being served, then HUD is going to assume that you are not serving an eligible client, even if you were. So if you're not documenting all this, again, you're not really doing yourself any favors. So far I've been talking about time and activity reporting. I haven't been using the word timesheets so much, and I think this will link to what Eli mentioned earlier. And that's because your time and activity report does not have to be your timesheet specifically. It can be kind of nice and luxurious to have a timesheet that has all the relevant pieces in it and tracks your time specifically. And you have a notes section that everyone is using rigorously, and the notes identify the clients and the activities. But we may not always have that type of timekeeping system available. So what you need to be able to do is to combine your timesheets and the actual time that you're tracking with some other backup documentation. So for example, being able to generate a report of case notes or case manager times from HMIS, from your service transactions, or from your internal case management system that you may be using that will easily align with and back up your timesheets. That's something that's really good to do. Or having some other place where you store this kind of information, if that's how you are addressing this. Say if you're pulling together all the required information from your timesheets and your case notes, or from a couple other places, you really do need to be able to pull all that information together quickly and easily when HUD comes to do a monitoring of your agency. If either you or HUD has to spend a couple of days searching around for all that backup documentation, then on the one hand, it's good if you can provide that when you're spending, when you're showing your spending costs in an eligible way, because at least HUD will not make you repay those costs. But on the other hand, you're probably still getting at least a concern, if not a finding, in your monitoring, if it really does take up that much time to just track down your information. So part of your responsibility here is to be able to produce these time and activity reports when you need them in order to document your invoicing. And you need to be able to self-monitor as well. So if you need to spend 3 days pulling together your information in order to prove that your costs are eligible and that your staff time is eligible, then HUD may think, well, you can't really monitor yourself. You can't confirm that you're invoicing us for eligible costs each time you're invoicing us. And that's a problem, because we need you to be invoicing us for eligible costs, and we need you to always know whether or not your costs are eligible. So if you're using multiple sources, just try to work toward a place where you can generate those reports and pull together that information and cross-reference it quickly and with relatively little effort. So next slide, please. Okay, so before we wrap things up, we're going to take a look at just a few examples. I just want to show you a few different sample time and activity reports. So these are specific examples of what a timesheet may look like if you're just doing a timesheet, and we're going to point out some red flags here too. So here I'm seeing time for this person tracked to grants, which is great, but I'm seeing 8 hours for grant, and I'm not really seeing any other information. I don't know what this person was doing for 8 hours on June 1st in order to support the clients through this grant. So if this is all I'm seeing in my documentation, then that's not really going to be enough. This is not a compliant time and activity report. So next slide, please. So this one's a little better. I am tracking vacation time, which is helpful. I'm seeing specific time that's being tracked, not just to grants, but to specific activities such as case management or training. There's not quite enough information here for me to determine whether this is eligible. I don't know what kind of case management was provided. There's something that I may describe as case management that HUD may not have included in its interim rule. So I may want to combine this timesheet with case notes that clearly show that this is the activity I was doing during that case management time, and to show that the training was eligible under the supportive services line item. So next slide, please. So here's a timesheet that could probably function as a time and activity report. It tracks time to individual clients and to specific eligible case management activities. It's broken down by time, and it's also tracked to specific grants. So this one here does include all the kinds of things that I'm looking for. So next slide, please. We're just going to pause for a moment and see if anyone has any questions. I know that's all kind of a lot to absorb. And questions too could be about timekeeping or anything else that we discussed today before we wrap things up.
Kyle, it sounds like as usual, you are incredibly clear.
Well, we do want to be thorough. Well, if that's the case, then I think we can probably call it a day. So thank you so much for your focus and your participation. We really do appreciate your time at these trainings and your focus on compliance, which we know is not the most important focus day to day, but it can be so important for maintaining these federal funding streams.